Hey everyone, Dr. James Whitaker here from American Urologist. And today I'm going to share something with you that every man over 50 needs to hear, but 95% of doctors are too uncomfortable to discuss openly with their patients. This is about penis health, something that directly impacts your confidence, your relationships, your self-esteem, and your overall quality of life. But what most men don't realize is that the changes happening down there after 50 aren't just normal aging that you have to accept. They're actually warning signs that something much more serious could be developing in your body. But before we dive into this life-changing information, I need you to do something right now. If you're a man over 50, or if you care about a man over 50, smash that subscribe button and hit the notification bell. Because what I'm about to reveal could literally save lives and restore the confidence that too many men have quietly given up on. Are you ready? Because this conversation is going to shock you and potentially change everything you thought you knew about your health. 3 months ago, I had a patient walk into my office who completely changed how I approach this topic with every man I treat. His name was Richard, a 54-year-old successful business owner from Denver, and he came to see me because of what he thought was just getting older and accepting it. Dr. Whitaker, he said, clearly uncomfortable and avoiding eye contact, I'm embarrassed to even be here discussing this, but my wife practically forced me to make this appointment. Over the past 2 years, things have significantly changed down there. My erections aren't as strong as they used to be. Sometimes they don't happen at all, no matter what I try. And when they do manage to occur, they don't last nearly as long. I figured this was just part of getting older and something I'd have to accept, but my wife is worried it might be something more serious. Richard paused, then continued with obvious frustration. Doctor, I'm only 54 years old. I shouldn't feel like an old man already, but that's exactly how I feel. It's affecting my confidence, my marriage, and honestly, my entire sense of masculinity. I've tried those over-the-counter pills, different techniques, even considered those prescription medications. But nothing seems to work consistently. What Richard didn't realize, and what 90% of men his age don't understand, is that his bedroom problems were actually early warning signs of potentially life-threatening cardiovascular disease. His penis was essentially trying to communicate vital information about his health that could literally save his life, if he knew how to interpret the signals correctly. After comprehensive testing, including blood work, cardiovascular imaging, and hormonal assessments, we discovered some shocking results. Richard had significant arterial blockages throughout his body, elevated blood pressure that had gone undiagnosed, dangerously high inflammation markers, and was on the fast track to a major heart attack within the next 3 to 5 years. His erectile dysfunction wasn't just about sex or aging. It was his body's sophisticated early warning system, screaming that his cardiovascular health was in serious trouble and immediate action was needed. But here's the incredible part that gives me hope for every man watching this video. Within 6 months of addressing the root causes of his penis health problems, using the exact protocol I'm going to share with you today, Richard not only completely restored his sexual function, but potentially added 15 to 20 years to his healthy lifespan. Doctor, he told me at his 6-month follow-up appointment with tears in his eyes, you didn't just fix my bedroom problems. You literally saved my life. I had absolutely no idea that what was happening with my erections was directly connected to my heart health. My cardiologist said the changes in my cardiovascular system are remarkable, and my wife says I'm like a different man, not just sexually, but in every aspect of my energy and confidence. This is exactly why I make it my mission to tell every man over 50 about penis health, and why you need to listen carefully to every word I'm about to share with you today. Why your penis is actually your body's most sophisticated early warning system. Here's what most men, and unfortunately most doctors, don't understand about male physiology. Your penis contains some of the smallest, most delicate blood vessels in your entire body. When cardiovascular disease starts developing anywhere in your system, these tiny penile arteries are often the first to be affected and show symptoms. Think about this logically for a moment. If blood flow is becoming restricted to your penis due to arterial narrowing, plaque buildup, or inflammation, What do you think is simultaneously happening to the blood flow to your heart, your brain, your kidneys, and other vital organs throughout your body? The answer is terrifying. The same process that's affecting your sexual function is also affecting your entire cardiovascular system. But your penis is simply the canary in the coal mine, the first organ to show symptoms because it has the most delicate blood supply. Erectile dysfunction isn't just a bedroom problem that you should be embarrassed about. It's often the first visible symptom of serious cardiovascular disease, diabetes, hormonal imbalances, or neurological problems. Multiple large-scale studies have shown that men who experience persistent erectile dysfunction are 70% more likely to have a heart attack within the next 5 to 7 years compared to men with healthy sexual function. Your penis is essentially acting as a sophisticated early detection system for heart disease, stroke, diabetes, high blood pressure, and other life-threatening conditions. But instead of recognizing these critical warning signs and taking immediate action, most men suffer in silence, thinking it's just normal aging that they have to accept. This couldn't be further from the truth, and this misconception is literally killing men who could have been saved with early intervention. The 5 penis health warning signs every man over 50 must recognize immediately. Let me share the 5 critical warning signs that your penis might be trying to communicate about your overall health. If you're experiencing any of these, you need to take immediate action. Warning sign number 1. Progressively weaker erections over time. If your erections aren't as firm, rigid, or reliable as they used to be, this often indicates reduced blood flow due to arterial narrowing, plaque buildup, or inflammation in your blood vessels. This same arterial narrowing and plaque formation is simultaneously happening throughout your body, including the crucial arteries that supply your heart and brain. Research shows that men who report significantly weaker erections have a 65% higher risk of coronary artery disease, even if they have no other symptoms. Warning sign number 2, increasing difficulty achieving erections. If you're having trouble getting erections that used to come easily and naturally, this could signal developing diabetes, which damages blood vessels and nerves, cardiovascular disease, which reduces blood flow, or significant hormonal imbalances that affect your entire body's function. Studies indicate that erectile dysfunction can appear 3 to 5 years before other diabetes symptoms become obvious. Warning sign number 3, erections that don't last or fade quickly. If you can achieve an erection but can't maintain it for satisfactory sexual activity, this often indicates venous leakage, blood flowing out of the penis too quickly, or nerve damage, both of which can be early signs of diabetes, cardiovascular problems, or neurological issues affecting your entire body. Warning sign number 4, significantly reduced morning erections. Healthy men should wake up with erections 3 to 5 times per week due to natural testosterone surges and REM sleep cycles. If this has decreased dramatically from your younger years, it could indicate dropping testosterone levels, sleep disorders, or developing cardiovascular issues that affect overnight blood flow. Warning sign number 5, decreased sensation and responsiveness. If you're experiencing reduced sensitivity, numbness, or decreased responsiveness to stimulation, this could be an early sign of diabetic neuropathy, circulation problems, or other nerve damage that's affecting your entire body's nervous system. The shocking scientific connection between penis health and heart disease. Let me share some research that will absolutely blow your mind and potentially save your life. The Massachusetts Male Aging Study, which followed over 1,700 men for decades, found that men with complete erectile dysfunction had a 70% higher risk of coronary heart disease compared to men without erectile dysfunction. Even more shocking, the prostate cancer prevention trial, which studied over 9,000 men, found that men who reported erectile dysfunction were significantly more likely to have cardiovascular events within the next 10 years, regardless of their age or other risk factors. But here's the part that really drives home the connection. Researchers have found that the average diameter of penile arteries is 1 to 2 millimeters, while coronary arteries average 3 to 4 millimeters. When atherosclerosis, plaque buildup, begins affecting your cardiovascular system, the smaller penile arteries become blocked first because they're more susceptible to even small amounts of plaque formation. This means erectile dysfunction can serve as an early warning system, giving you potentially 3 to 5 years to address cardiovascular problems before they become life-threatening heart attacks or strokes. Richard's Complete Transformation Protocol. Instead of just prescribing standard erectile dysfunction medications that only mask symptoms without addressing root causes, I worked with Richard to implement a comprehensive protocol that targeted the underlying health issues causing his problems. Here's exactly what we did, and you can implement these same strategies starting today. Phase 1. Comprehensive cardiovascular optimization. We immediately began improving Richard's heart health through targeted nutrition, specifically focusing on foods that naturally boost nitric oxide production and improve blood vessel flexibility. This included daily consumption of nitrate-rich vegetables like beets and spinach, citrulline-rich foods like watermelon, and antioxidant-rich berries that protect blood vessels from damage. We also implemented a structured exercise program combining cardiovascular training to improve heart function with resistance training to boost natural testosterone production. Within 30 days, Richard's resting heart rate dropped from 78 to 62 beats per minute, and his blood pressure decreased from 145/90 to 125/78. Phase 2. Advanced hormonal balance restoration. We naturally optimize Richard's testosterone levels through specific dietary changes, sleep optimization, and targeted supplementation. This included ensuring adequate zinc intake through foods like oysters and pumpkin seeds, optimizing vitamin D levels through safe sun exposure and supplementation, and managing stress levels to reduce cortisol production that interferes with testosterone synthesis. After 60 days, Richard's total testosterone increased from 340 nanograms per deciliter to 580 nanograms per deciliter, a 70% improvement, and his free testosterone, the bioavailable form, more than doubled. Phase 3. Systematic inflammation reduction. We eliminated the chronic inflammation that was damaging Richard's blood vessels and affecting his sexual function through dietary modifications, omega-3 fatty acid supplementation, and removal of inflammatory foods from his diet. This included eliminating processed foods, reducing sugar intake, and incorporating powerful anti-inflammatory foods like fatty fish, turmeric, and green tea. Blood markers showed Richard's C-reactive protein, a key inflammation marker, dropped from 4.2 milligrams per liter to 0.8 milligrams per liter within 90 days, a reduction of over 80%. Phase 4. Comprehensive stress management and sleep optimization. We addressed the psychological and physiological stress factors that were contributing to Richard's performance anxiety and sexual difficulties. This included implementing meditation practices, optimizing his sleep schedule to ensure 7 to 8 hours of quality sleep, and teaching stress management techniques that reduced cortisol production. Richard's sleep quality improved dramatically, and he reported feeling more energetic and mentally clear than he had in over a decade. The results of this comprehensive approach were absolutely remarkable and exceeded even my expectations. Within 6 months, his erectile function improved by over 80%, with firm, reliable erections returning. His blood pressure normalized completely without medication. His cardiovascular risk markers dramatically improved across the board. His energy levels and overall vitality were completely restored. His confidence and self-esteem returned to levels he hadn't experienced in years. His relationship with his wife became stronger than it had been in over a decade. But most importantly, his cardiovascular health improved so dramatically that his cardiologist said he had essentially reversed years of damage and significantly reduced his risk of heart attack and stroke. 10 natural strategies to optimize penis health and potentially save your life. Based on 25 years of urology practice, treating thousands of men, and staying current with the latest research, here are the 10 most effective natural strategies to optimize penis health while simultaneously improving your cardiovascular health and overall longevity. Strategy number 1. the Advanced Nitric Oxide Protocol. Nitric oxide is absolutely crucial for healthy erections because it relaxes blood vessels and allows increased blood flow to the penis. Consume foods rich in nitrates, which convert to nitric oxide, and citrulline, an amino acid that boosts nitric oxide production, daily. This includes beets, spinach, arugula, watermelon, pomegranate juice, and dark leafy greens. Studies show that men who consume high-nitrate foods regularly have 50% better erectile function than those who don't. Strategy number 2, the omega-3 optimization system. Take high-quality fish oil containing at least 2,000 milligrams of combined EPA and DHA daily to reduce inflammation throughout your cardiovascular system and improve blood vessel flexibility. Research shows that men with higher omega-3 levels have significantly better sexual function and lower rates of heart disease. Strategy number 3, the zinc maximization protocol. Ensure adequate zinc intake through foods like oysters, the highest natural source, pumpkin seeds, grass-fed beef, and dark chocolate. Zinc is essential for testosterone production, sperm health, and proper immune function. Men with optimal zinc levels have testosterone levels up to 40% higher than zinc-deficient men. Strategy number 4, the comprehensive exercise system. Engage in both cardiovascular exercise, at least 150 minutes per week of moderate intensity, and resistance training, 3 to 4 sessions per week, to improve blood flow, boost natural testosterone production, and enhance overall cardiovascular health. Studies show that men who exercise regularly have erectile function equivalent to men 5 to 10 years younger. Strategy number 5, the sleep optimization protocol. Get 7 to 8 hours of quality sleep in a cool, dark room to support natural testosterone production and overall cardiovascular health. During deep sleep, your body produces 70% of its daily testosterone, and poor sleep directly correlates with erectile dysfunction. Strategy number 6, the stress reduction and cortisol management system. Practice stress management techniques like meditation, deep breathing, or yoga to reduce cortisol levels that interfere with testosterone production and sexual function. Chronic stress can reduce testosterone by up to 50% and significantly impair sexual performance. Strategy number 7, the weight optimization plan. Maintain a healthy body weight through proper nutrition and exercise. Every 10 pounds of excess weight can decrease testosterone by 75 nanograms per deciliter and significantly impair sexual function. Losing excess weight often dramatically improves erectile function within weeks. Strategy number 8, the vitamin D maximization protocol. Optimize vitamin D levels through safe sun exposure and supplementation. Men with vitamin D levels above 30 nanograms per milliliter have testosterone levels 25% higher than deficient men, and vitamin D is crucial for cardiovascular health. Strategy number 9, the regular monitoring and testing system. Work with a qualified healthcare provider to regularly monitor your cardiovascular health, hormone levels, and overall wellness through comprehensive blood work at least annually. Early detection and intervention can prevent serious health problems. Strategy number 10, the relationship and communication enhancement. Address relationship issues, performance anxiety, and communication problems with your partner. Psychological factors contribute to 80% of erectile dysfunction cases, and improving relationship dynamics often dramatically improves sexual function. You might wonder why this comprehensive information isn't standard medical practice, or why your doctor hasn't discussed these connections with you. The unfortunate truth is multifaceted. First, most doctors are genuinely uncomfortable discussing sexual health in detail. Medical training focuses heavily on pathology and treatment, but provides minimal education about sexual wellness and the connections between sexual health and overall health. Second, our medical system is specifically designed to treat symptoms rather than address root causes. There's significantly more profit in prescribing medications that patients take indefinitely rather than teaching comprehensive lifestyle approaches that address underlying health issues and potentially eliminate the need for medications. Third, pharmaceutical companies invest billions of dollars in marketing erectile dysfunction drugs to both doctors and patients, but very little money is invested in research or education about natural approaches that don't generate ongoing revenue. Finally, the standard medical appointment structure of 10 to 15 minutes simply doesn't allow time for comprehensive health education and lifestyle counseling that would actually address the root causes of these problems. What Richard's case taught me, and what I want every man to understand, is that penis health is essentially a window into overall male health and longevity. When we optimize sexual function naturally by addressing root causes, we simultaneously improve cardiovascular health and circulation throughout the entire body, hormonal balance including testosterone, insulin sensitivity, and stress hormones, mental clarity, mood, and cognitive function, energy levels and physical stamina throughout the day, sleep quality and recovery from physical activity, overall longevity and quality of life as we age, confidence, self-esteem, and relationship satisfaction. This comprehensive approach doesn't just restore sexual function, it can literally add healthy years to your life while dramatically improving your quality of life during those years. Here's exactly what I want every man over 50 to implement, starting immediately. Week 1. Assessment and foundation. Get comprehensive blood work including complete metabolic panel, lipid profile, testosterone, total and free, PSA, vitamin D, inflammatory markers, CRP, and HbA1c for diabetes screening. Establish baseline measurements for tracking progress. Week 2, nutrition optimization. Implement the Nitric Oxide Protocol with daily consumption of nitrate-rich foods. Eliminate processed foods, reduce sugar intake, and increase consumption of anti-inflammatory foods like fatty fish, vegetables, and berries. Week 3, exercise implementation. Begin a structured exercise program combining cardiovascular training, walking, swimming, cycling, with basic resistance training. Start with 30 minutes of activity 5 days per week and gradually increase intensity. Week 4, sleep and stress management. Optimize your sleep environment and establish a consistent bedtime routine. Begin practicing stress reduction techniques like meditation or deep breathing for at least 10 minutes daily. Month 2, advanced optimization. Add targeted supplementation including high-quality fish oil, vitamin D if deficient, and zinc if needed based on testing. Continue building on the foundation established in Month 1. Month 3 and beyond. Monitoring and refinement. Work with a healthcare provider who understands these connections to monitor your progress through follow-up testing. Adjust your protocol based on results and continue optimizing your approach. Richard's transformation from a man worried about bedroom performance to someone who potentially added decades to his healthy lifespan proves that penis health problems aren't just about sex or masculinity. They're literally about survival and longevity. Your penis is continuously trying to communicate vital information about your cardiovascular health, hormonal balance, and overall wellness. Instead of ignoring these critical signals or simply masking them with medications, you need to use them as powerful motivation to optimize your entire health profile. The same evidence-based strategies that restore healthy sexual function also provide protection against heart disease, stroke, diabetes, cognitive decline, and other age-related health problems that rob men of their independence and quality of life. It's time we stop treating penis health as a taboo topic that men should be embarrassed about and start recognizing it as a critical component of men's overall health, longevity, and quality of life. Every man over 50 deserves to understand how his sexual health directly connects to his cardiovascular health, hormonal balance, and life expectancy. More importantly, every man deserves to know that comprehensive, natural solutions exist that can address root causes rather than just temporarily masking symptoms. The shame and silence surrounding these issues is literally killing men who could have been saved with early recognition, proper education, and comprehensive intervention. Thank you for watching American Urologist. I'm Dr. James Whitaker, And I believe every man deserves honest, comprehensive information about his health, especially the topics that make us uncomfortable but could save our lives. If this video could help someone you care about, please share it immediately. You might not just be sharing health information. You could literally be saving a life by encouraging someone to take action before it's too late. Hit that subscribe button, turn on notifications, and I'll see you in the next video where we'll discuss the 5 foods that naturally boost testosterone levels and the 3 popular supplements that are actually making your hormone problems worse. Your health is absolutely worth having the uncomfortable conversation, and your best years definitely don't have to be behind you.